Welcome to the Medical Billing Process Training. This is Cesar Landeros, your host for today. We will be looking at the medical billing process in general and working through each step so that you begin to understand how medical billing works. The first question we want to ask is, what is a medical billing claim? Well, you need a provider and you need a patient. A provider is usually the doctor, the physician assistant, or the nurse practitioner. They are the ones who render the service, who provide the service. The patient is the person who consumes the service, who purchases the service from the provider. Just like in any type of other business, there is a seller and then there's a consumer, except that this is medical services. So there is a service provider and there's a service consumer. The service begins with an encounter or a meeting between the patient and the provider. That's what's called the patient visit or patient assessment. Here, the provider can be a physician assistant, a nurse practitioner, or a physician that can see the patient. There are other types of providers, but we only use here physicians, physician assistants, and nurse practitioners. The patient will come and see the doctor, and we will have to determine where was this patient seen. Was the patient seen in the office? Was the patient seen in the nursing home, hospital, or at home, or other places? For the purpose of this training, we're going to stick to office visits or nursing homes. So again, the claim is really an invoice of the service that was provided by a service provider, usually a physician or a clinical practitioner, and the patient coming together for an assessment. The encounter then occurs and a claim can be created. The billing process is a process that has different facets. You can see here that it is not just one thing or one part of it. Many people who actually do medical billing or even have gone through medical billing school will find that very often they only know and have become really good at one particular part of billing. That might be coding, or that might be accounts receivable or insurance verification, but very seldom we see individuals who truly understand and can work in all of the components of medical billing. Medical billing really begins at the insurance verification component. This is because, of course, like with any other type of business, you would want to know, can the person pay for the service? And in this case, we want to know, can the patient pay for the services either through cash basis or insurance? So insurance in the US, of course, is covered either through government insurance or private insurance. Things that you need for your claim creation are going to be things such as your benefit eligibility. Again, if the patient has insurance, then you want to be able to verify their eligibility through that insurance. We will do that through the face sheet. The face sheet will tell us information such as the insurance, social security number, date of birth, address, etc. Then we will want to look at the encounter form, or what's also known as the physician note. The provider will visit with the patient, create an assessment, what's normally known as evaluation and management, and will determine what treatment they will provide, if any, during that time. These are known as procedures. The face sheet is a form that is completed for most clinical settings, whether it's a hospital or nursing home or office. There usually will be a face sheet, and this captures the demographics of the patient, the basic information that you need about the patient in order for you to build a profile. There may be a lot of ways to refer to the face sheet, but the most common name is face sheet. They can also call it demographics sheets or sign-in sheet, etc. The demographic sheet gives you, or face sheet gives you, the main characteristics or basic data of the patient themselves so that you can build a profile for the invoice of that you will be sending to the patient or the insurance. The invoice meaning the claim. The encounter is when the doctor has already seen the patient and they are now completing their documentation. This will tell us when the patient was seen, which is referred to as date of service, why was the patient evaluated, That's referred to as chief complaint, and it's documented via ICD-9 codes. What treatments were provided, and not all treatments are billable, so you have to be cautious about this because you have to understand the CPT codes and what is billable and what is not billable. Who the rendering provider is, was it an MD, a PA, or an NP? Where the service was rendered, this is called a place of service, and how the procedure was carried out, details of the treatment. Translating all of this into medical billing requires codes. These are referred to as CPT codes and ICD-9 codes. CPT codes tell us what treatment was provided. These are referred to as procedures, and there are usually two types. One is the E&M, Evaluation and Management. This is the assessment codes. And then the second is your treatment procedure codes, which are usually referred to as CPT. Then you have your ICD-9 codes. This tells us why the patient was seen. It's basically the diagnosis, the medical reasoning for evaluating the patient and rendering procedures. So this again, in order to translate all of it, basically tells us through the codes when the patient was seen, date of service, why the patient was evaluated, ICD-9 codes for diagnoses, what treatments were provided, CPT codes for procedures, who the rendering provider is, where the service was rendered, place of service, and how the procedure was carried out. Details of the treatment so we can determine different levels of the CPT codes. So again, let's discuss the types of CPT codes. Procedure codes tell us what I did during the visit. There are two types, CPT codes for the procedures and E&M or Evaluation and Management codes. Then we have the ICD-9 codes, which tell us why I did it. Basically the diagnosis, the actual diagnosis of the patient's conditions. And these two must make sense together. Of course, if you see a patient for abdominal pain and your diagnosis has to do with hypertension, then they will question, well, why are you treating, abdominal pain, but the patient doesn't have any diagnosis for anything having to do with the abdomen. So what can I bill? Well, you can bill two things. You can bill the visit, which is usually your E&M codes, and you can bill for procedure, your CPT codes. Those are the two things that you will be billing for. And everything that you do in the medical billing will fall into these two categories, visit codes and procedure codes. And then you have to directly link your visit codes and procedure codes to the reasoning, your medical reasoning, which is your diagnoses, that are going to be directly related to your visit and your procedure that you're doing on that day of the service. So for example, in this particular example, we will have a follow-up visit. There will be a PA seeing the patient. The diagnosis of the patient is diabetes, PVD, sacrococcyx pressure ulcer, that is 10 by 5 by 3 centimeters, right toe ulcer, and the procedure that was rendered was a debridement only performed to the sacrococcyx down to the muscle. So you could see we have all the components here of the example. This is what it would normally look like in the medical billing system. So you have to determine what are going to be my CPT codes. Well, we know that there's definitely a visit code and there's a follow-up code instead of a new visit. And we know that there is a pressure ulcer debridement that was done to the sacrococcyx. So I know that I will have a evaluation code and a procedure code. Now next you have to determine, do I need a modifier? And we will discuss modifiers in a different training, but you need to determine here, do I need a modifier? How many units for each of the CPT codes? And then you have to determine what are the diagnoses that are going to be directly related to my CPT codes. And it is important that you understand that diagnosis here requires sequencing. You can't just put all the diagnoses just because there's boxes there. You have to put diagnosis 1, 2, 3, and 4. There's a specific sequence that has to follow in order for the claim to be accepted. Diagnosis 1 meaning your primary diagnosis, 2, 3, and 4 are your supporting diagnoses that will support the reason for the actual visit themselves as well, or additional CPT procedure codes. So the creation of the claim, again, there is a process that the entire billing has to go through in order for the claim to be not just created but to be paid. But the creation of the claim begins with the verification of insurance benefits and capturing the demographics of the patient. Then we have to determine the proper coding of the patient visits so we know what to bill the patient or the insurance. Once we have captured these two things, we will then enter it into the medical billing system in order to create a claim for the insurance company. This is known as charge entry. Once you have gone through this, you will then follow step 5, 6, 7, 8, and 9. Step 5 is what's called claim submission. But we will stop right here and go on to the next training.